Welcome to Sonographers in the Cities, where we connect through sound with your hosts, Lynn and Geselle. Hi everyone, welcome back to another episode of Sonographers in the Cities. I'm Lynn.
And I'm Geselle.
Thank you so much for tuning in to this episode and any other episodes that you have been listening, watching. We appreciate you. What else? Well, we hope you enjoy all the episodes that you listened. Geselle and I love doing this. We're super busy in our work lives and personal lives, but we make time to do this for you.
Yes. So thank you guys so much for listening. We have seen an uptick in our viewers and our podcast listeners and downloads, which is really exciting. So comment down below or let us know on Instagram where you found us from, if you're new here, or where you're listening from, because we love to see it. And we love talking ultrasound. We love doing this. Hope you guys enjoyed our last episode with Natalie, and we're here to talk more about ultrasound.
Yay.
Yay.
As if we didn't work all day today already.
Yeah. We did already talk about ultrasound before we got on to record. We also worked all day in ultrasound. So ultrasound is life, guys. I mean, you guys are listening to ultrasound podcast. It's life.
Yes. It's our lives, it's your lives.
And we're in this together.
Yes.
And remember, I mean, I feel like we do this because it takes a certain type of person, aka sonographer or sonography student, to understand what we're going through, because not a lot of people understand what we're going through when we have these stresses in life or at work or in school, except for each other, our classmates, our mentors, our peers. And doing ultrasound is so much harder than what people actually think. I'm actually going to pull up this post that somebody posted in the Discord. If you're not in the Discord yet, what are you doing? You
message Geselle so you can join.
You can join. And let me tell you what one of our longtime followers, friends, coworkers, well, not coworkers, colleagues, his name is Jesus, and I don't know if any of you guys know him, but he's been in the Discord and the Facebook group for a very long time. And he likes to make things funny, because in ultrasound and medical, you have to have a sense of humor to like get through your days, because it does get really taxing, mentally, physically. And you gotta have some humor, right? Well, he posted something today, and if you're on YouTube, you can see it's a little image. Or maybe you can't see, it's so bright. But it's a little image of basically someone talking about sonographers. And what it says is, being a sonographer is not too physically demanding. Compared with some medical roles, being a sonographer is not too hard on the professional's body. The only physical demands relate to being able to stand for sometimes long periods of time. And he highlighted that because, for those of us who know each other in this field and who've been doing ultrasound and understand what a sonographer does, you probably are like, wait, what? Who wrote that? And what are they talking about? And
I would like to know about this article.
Yeah.
Like, who's the author?
So that's what he said. He said, I'm trying to hunt down the article and let the author know how wrong they are. Because whoever wrote that, totally wrong.
Where did he find this?
I don't know, but that's something that we as sonographers or sonography students know is not true. It's saying not too physically demanding, but I would say it is. I would check off the box that it is physically demanding. You talk about work-related musculoskeletal disorders. 90% of sonographers are scanning in pain. Yeah, that's pretty much a huge statistic, a big part of being a sonographer, and what we're going to discuss today, which is part of how to deal with difficult exams and difficult patients. And I just found it quite interesting that that is there. And I commend all of you who are going into this field, who are in this field currently. And for those of you who know these things going in and doing your research, listening to our podcast, still wanting to do ultrasound. How do you feel about that, Lynn?
I think it's awesome. It's very commendable. Unfortunately, I can't say the same for myself because obviously I didn't have a podcast to listen to or didn't do that much research. But that's why we do this podcast, to have an extra resource for you guys to listen, to get your research going, to make sure that you know exactly what you're going into, so that you don't regret in the future, because it is your future that we're talking about.
Yeah. We're talking about things where you're spending time, money, energy to go into a field, and it's good to do research or good to figure it out beforehand. I mean, if I knew all these things that I knew today, I don't know, would I have done something else? Maybe. I mean,
Probably.
if I had known all those things, maybe I would have looked for something else. But I feel like going into this field, it's made me grow as a person. It's challenged me. I continue to learn and grow every day. And yeah, we have stressful days and we have hard, difficult exams, difficult patients, but it just makes us stronger as a sonographer and a human being, right?
Yeah.
So we're gonna talk about difficult exams. So what do you do, Lynn, when you have a difficult patient or a difficult exam? Like what goes through your mind?
Well, as a new grad, it's a little bit different than when I was a student. Like when I was a student at clinicals, when I see like a very severe pathology, usually I'm just like, okay, I have a severe pathology, and then I run to my preceptors to double check and make sure that I it is what I'm seeing. And now as a new grad, a lot of it is my responsibility. I check the priors, and to make sure that their disease or pathology is there if it has worsened, and it is up to me to determine that if it's still the same, or if it has worsened, or it has improved. And I, I'm fortunate enough to have like my mentor, my senior colleagues that I can, get a second opinion on. But most of, like, I would say 80% of the time, um, it's up to me to, collect all the clues or the facts and present it to my manager or my senior colleagues that, hey, I think it is, like a 80 to 99 stenosis, or there's a occlusion because of this, and this. And do you agree? Do you not agree? And then, I would have to go to the doctor, notify the doctor, and see if they agree. So it's like that back and forth of like communication. Like, if you don't agree, let me know, I'll change it. So it's like another step more into than just a student. But scanning, I would have to like mentally prepare myself, like what if there are any priors, I check the images. If not, I'm just gonna, whatever I see is what I get. So yeah, but I don't freeze as much
Like when
as
you were a
before.
student.
Yeah, I was like, oh, there's black, there's something, I don't get anything. What do I do?
Yeah.
But now I just like, if I don't get it, I move on. And
Yeah.
then deal with it later.
Mm-hmm.
And
Yep.
now I get a little rush when there's pathology, because I'm like, oh, this is so cool.
Yeah.
So, but yeah.
Yeah. No,
What about
it's a
you?
it's definitely a process, I think,
It's a
especially
long
me.
process.
Right. Like you as a student, let's talk about like rewind because a lot of you guys are students.
Mm-hmm.
So obviously as a student, when you see something wrong or something that's difficult, obviously something is churning in your mind like, hey, that doesn't look right, you know? So your first step obviously is to use your thoughts, everything you've learned, how you learned to describe things. How would you describe that thing? And
Mm-hmm.
you know what normal looks like, and you don't question what something normal looks like. So when you see something abnormal, you're probably like, huh, what's that? Let me think about what all could be going on in there in the
Yeah.
liver or the vein or the kidney.
Mm-hmm.
And I think as a student, it was obviously a learning situation for myself and trying to figure out, okay, what do I do? Oh my gosh, like, but what I had learned as a student too is you see something, you document it, you take your images, you do your color black and white. If you need to Doppler something, Doppler it, get it in Sag and Trans. For those of you who don't know what Sag and Trans are, you get it in different planes, multiple images, and you continue on. And it's harder as a student, I think, to trust yourself when you're doing these kinds of things, but that's what your mentor and your preceptors are there for. But it's definitely something that you need to go through because that's how you learn and that's how you get better. But when I do get difficult patients now, you know, as a sonographer, I'm thankful for all those hard, difficult patients as a student because once you see something, it sticks in your mind. I remember the first time as a student, I saw adenomyomatosis in a gallbladder. And
Ooh.
that, when I first saw that, right, you see a gallbladder and you're like, ooh, a normal gallbladder. You're like, ooh, pretty gallbladder. Then you see something wrong with it. You're like, oh my gosh, there's something wrong with the gallbladder. And you're like freaking out in your head, like, what do I do? But yeah, the best thing you do as a new grad is you take the pictures and you try to figure it out how to describe it. And when I was a student, after the fact, there's like, yeah, so that's adenomyomatosis. And I remember now that every single time I get that kind of gallbladder. So the difficult exams help you become better because that's how you're like, oh, I
Mm-hmm.
know what that is now, you know? But you take it, with a learning lesson, like learning goggles, and you're like, okay, and you try to remember that. But now how do I deal with that? If it's something crazy too, like something that I absolutely have never seen before, because there are things that people who have been doing ultrasound for 20 years and they haven't seen it. There's things in those textbooks that were like, I wonder if I'll ever see that. People will never see in their lifetime, but you might see it one time. You are able to use your skills to just describe that and, do your due diligence. Like Lynn says, look at other priors and history and be the detective that you are because sonographers are truly detectives. We don't just
Yes.
take the pictures and like go. And I feel like that's why I love this career so much because it's so much thinking and it makes your brain kind of like work all the time. You're not just like, you're all actively thinking about things. And so I am, you know, thankful for difficult things. Not that we want to see difficult things, but it helps us become better for us to be able to understand it next time. Like I'm sure the first time you ever saw a DVT, aka blood clot, you're like, oh my gosh, what's that? Or like an occlusion.
Actually, for the longest time,
Mhm.
all my DVTs were negative. So I was
Ah.
like, will I really know an acute DVT if I see one? Because I've
Hmm.
never seen one.
Yep.
And then all of a sudden, my first DVT, it was in the gastroc. And I think the
Mm.
gastroc is like one of those locations where it's very hard to see
Hmm.
even. And I was like, how do people see this? Like, since I was a student, I was like, how can you see? Because all I just see is like, the striations of the muscles, like along with like the veins. And I
Mhm.
was like, I could be like, I could not think, just think that I would find, and my first acute DVT is in the gastroc.
Mhm.
And I found it, and I was like, oh, it's not compressing, but the other one is compressing. So it stood out to me immediately.
Yeah.
So after that, I became more confident in
Mm.
identifying acute DVTs.
There you go. See, and it just takes that one to challenge you. And
Yeah.
it's that difficult exam that helps you learn and be better. So, this podcast episode is about how to handle those situations, and you go through it with a positive mindset that you're going to try to figure it out what's best for the patient. A lot of you guys ask
Mhm.
the same question, which is, what do I do? I'm more worried about like missing something,
Mhm.
or I'm worried about like how do you make sure you're getting the best images, but also, making sure you're not missing something that you could have caught or anything like that. And I just want to say that, like, for difficult exams, sometimes you just can't get something on ultrasound. Ultrasound's not magic.
Mhm.
And your number one thing to do is to make sure the patient is taken care of, number one. And number two, that you did your best. There's other
Right.
modalities too. There's CT, MRI, X-ray, nuclear medicine for a reason. And if you can sit there and say that you did your best after that scan, I think that's what that patient deserves. Obviously talking to the patient, making sure that they're okay, and making sure that in difficult situations, you learn how to speak to them. I think that's important too during that process. And these are all things you guys are going to learn from your mentors and from the people around you.
Like for me, like what I worry the most is that accidentally saying things out loud when you're not supposed to. Because, when I see pathology that I've never seen before, and I haven't practiced my poker face yet. It's the patient can read your face and be like,
They
"Oh,
can.
what's wrong? What's this?" So, like, my first thought, like, I've always been careful about this, is like, I don't tell them anything. And I think that's scarier for me than missing something, If,
Mm.
like, to me, if I find something that I'm questioning about, and if I miss something, my preceptor or my a senior sonographer will pick it up, you know. It's just I'm worried that I would accidentally spill something to the patient that I'm not supposed to. I think that's my
Yeah.
biggest fear of doing a difficult exam.
Hmm. Yeah, that's tough, especially like if you're doing like let's say a breast
Mm-hmm.
mass.
Yeah.
I've had those situations where, patients it makes it, there's two difficult aspects to it. One, you're trying to find this mass in their breast. And then two, it could potentially be cancer, and that patient's so worried and they're talking to you and they're all worried. They want to know what's going on. So, number one, you have to be patient with yourself finding the breast
Mm-hmm.
mass already, because that's hard. It's like finding a needle in a haystack. Two, being patient with the patient and
Yes.
making sure you're comforting them, not confront,
Yes.
comforting them, because you are doing, like, a sonographer's job is so much more than just taking images. And um it is mentally draining, it's physically draining
Hmm.
because of how we're scanning these patients. And another thing is patients are getting sicker,
Yes.
like there are more sicker patients. There's worse habits nowadays, I think, than there ever was. There are also increased body mass indexes. Like, there's all these factors that are making ultrasound so much harder now. Increased patient load with decreased staff. So the pressure, the stress that we're all under, it's a lot, but I mean, if you are someone that's dedicated to this field and to your job, you're gonna do what's right. You're gonna do the best that you can. You know, we're not just going in there blindly doing whatever. We're actually doing things under a protocol and making
Yes.
sure we're checking off these boxes. We're taking the right images. We're doing the right things. And just know if you have a difficult patient or a difficult scan, difficult exam, you typically, I've worked at a lot of places out here in Las Vegas, and you typically have people there around you who you can ask for help. If there's not, there's a radiologist or a doctor. If there's not, there are still people who are saying, like, I even tell my coworkers or students, like, hey, if you have a question, you can always ask me, because that's how we learn. And you just hope that you're in an environment like that. If you're not, you learn a little bit faster on your own, and that's just kind of how it is.
Yeah.
If you're by yourself, there's a lot of sonographers out there I see that work by themselves in an office with like 15, 20 patients, and they just learn, but that's difficult in itself. So just have the right mindset. We also always talk about work-life balance, or like just taking time away from ultrasound and processing everything, because these things are hard. I saw actually a video recently on, I think it was Instagram, where someone was like, healthcare workers are so strong and we're just like crazy human beings, because you could go in and see someone code at, like, in the middle of your shift, and you still go home to dinner,
Yeah.
to your family, like, and that's a lot to process. Or you see really, really sick patients at work, but you still have to, and you do difficult things, but you still have to live your life normally too.
Mhm.
So it's very, very special to be a healthcare worker, I think. And just
Agreed.
know that we're all going through the same things, and we're here for you guys. So if you ever need to
Yeah.
talk about a difficult exam or a hard patient, hard day, that's what we're here for. The Discord, our
The
Instagram, and you can
Facebook
always
group.
reach out. Yep. There's so many things out there. But I don't know, how do you feel now knowing that you are a new grad and you saw all the things in clinical? Do you feel like you were prepared for the difficult things that you're seeing now? Or do you
Like,
feel like,
I think mentally, like, I don't know if I'm gonna word this correctly. Like, I was mentally prepared for difficult pathologies, if that makes sense.
yes,
Like,
because
for
you knew
skills,
what to look
for
for?
skills wise, I know that I'm not there yet, when I finish my program.
Mm-hmm.
But I was mentally prepared to go in and get all those difficult studies because I
Yeah.
want to see it all. I want to be able to know it all and be
Mm-hmm.
able to confidently scan it so that I can scan it as accurately as I can.
Mm-hmm. Yeah.
Yeah.
And then with time, you get better with the skills and all the other things. But
Yes.
that's the number one part of your job, is to be able to catch those things and be a
Hmm.
sonographer that can find the abnormalities, that can find the occlusion, can find the stenosis, and find all the difficult things that we find.
It's
But
so
then,
much.
yeah, but then they add that layer of being a healthcare worker, and taking care of your patients. So
Yeah.
it is a lot, and it's something that I think a lot of people don't think about going
Hmm.
into the field. They think like, I'm going to
No.
be a sonographer and help people,
Yes.
but then you don't realize how many layers are in that helping people, and you
Hmm.
have to make people comfortable. Like today, one of my patients was crying, and we had to try to comfort her too. So it's a lot. And I see floras and paras every single day. I see a lot of them. But then for that one patient, that's their first time getting it done.
Mm-hmm.
So for me, it's like, oh, this is normal for me. I do this all the
Mm-hmm.
time. For them, they're coming in and they're scared to death.
Right.
and I see it and I'm like, oh, that's nothing, but to them it's a whole thing. So
Right.
yeah. But being a sonographer is very, very, I think, rewarding. And
It is.
if you guys still, after listening to this episode, knowing we have hard, difficult patients and exams, want to do it, you are in the right place.
Agreed.
Yeah.
Speaking of one of the cases you did today, I saw is I'm gonna say this wrong, nephroblastoma,
Uh-huh. Wow.
right?
Uh-huh.
Uh, it's children's cancer, right?
Mm-hmm.
And I was like, oh my gosh, I remember learning this in abdomen too. It's like I can't believe I'm
Yeah.
seeing it with like my two eyes.
For it was a pediatric patient?
It was a pediatric patient in the PICU, and I
Oh.
was scanning his renals,
Mm-hmm.
and it was really sad.
Oh.
Whenever you have pediatric
Yeah,
patients,
that's tough.
it's very sad. But um in in like I was very excited because I saw pathology that I learned
Mm-hmm.
in school.
Yeah.
And children's cancer is, they say rare, but it's my first time seeing it, and I'm like, oh my gosh,
Yeah.
the
Mm-hmm.
kidney was so echogenic, like compared to the liver. It's like the
Mm-hmm.
liver is super hypoechoic.
Right. And see, you've never seen it before, but you knew how to
Yeah.
pick up those clues and
Yes.
how you're like, oh, so it's brighter than the liver. That means medical renal disease
Um,
of some sort.
yeah, I'm like, now I can sit for my RDMS. Just
Mm-hmm.
kidding.
Let's go. Take another registry. And that's part of the job. And it's really
Yeah.
cool that you saw that, right? Because you never saw it before. And
No.
that's how this job is. And it's really cool.
Yes. And I'm starting to scan more abdomen now,
Mm-hmm.
and I was like, ooh, I can do these liver views. I can scan the gallbladder. I can measure the anterior wall, but it's not part of our protocols because ours is vascular. But I just
Yeah.
want to do a quick sweep to see like if they have the I don't know. It's just like if I can get all these gallbladder views and like portal veins and CBG, it's all the abdomen stuff
Yeah,
that
look
I
at
learned,
you.
right? And I'm just like, should I sit for my
You
abdomen now?
should. You just did a whole abdomen.
No, I was just sweeping for fun.
Uh, yeah,
It
but that's
was,
cool.
yeah, it's really fun. I was
Sweet.
like, oh, it's just like throwback from what I've learned in school, and I'm like,
Like,
I
wait a
should, I
minute.
should.
Mm-hmm. Yeah, you never know. You can always do that. You did go to
And
school for it.
I know I did.
If you ever get, this is the beauty of ultrasound. If you get tired of one or like one specialty, you can go do another.
That is
I
true.
do all different specialties, and sometimes I'm like, wow, I can never get bored because I do all different kinds of things and I scan all different kinds of things. It's not just one thing all day long.
And each thing has multiple pathologies.
Mm-hmm. Like your liver, your kidney, and then you can have something wrong with like the gallbladder, the spleen, everything all at once or nothing at all.
Yes.
But ultrasound is so interesting. Like I just can't believe that it's something that I get to do for a living. I still don't feel like,
And you get paid for it.
yeah,
Like
it's crazy
you get
because
paid to look inside people's bodies.
we're body investigators. People always laugh when I say that. I use that as a joke, so you guys can use it too.
Body investigators.
Yeah.
Hello, I'm Lynn, your body
We're investigating
investigator.
your internal body parts, which is so weird to say.
Right.
But we're so smart. You guys be
Hmm.
proud of being a sonographer because
Yes.
we know a lot of things. We know a lot of things.
It's
People,
just all up here. We can't say it,
yeah,
but it's up
it's in
here.
our brain, but nobody knows all the things that we know. It's like a huge flex if you say you're a
Yes.
sonographer, but a lot of people don't know. Like
Yeah.
they
No.
don't know, but it really is
Yeah.
because we know a lot of things. And it's a really cool career. So if you guys are still hanging in there, hang in there. You can do it. You know, I see a lot of you guys in the Discord that's almost done and graduating soon. So congratulations to you guys who are making it through. And to all the people who are messaging us to be added to the Discord, we're gonna add you. And also, thank you for supporting the podcast and the channel.
Yes. And again, our podcast on Instagram made over 1,000. So thank you so much for following us.
Thank you guys. Yes, we're so happy. We're growing and it's amazing. So let us know if there's anything else you guys want to hear, and we'll get that for you.
Yes, thank you. Until next time.
Bye. Hey, SITC fam. If you like what you're hearing, don't forget to rate us 5 stars on any podcast platform. Leave us a review wherever you can. And don't forget to subscribe to Lynn and Geselle on YouTube. Follow us on Instagram and find us on Facebook at Sonographers in the Cities.